So let us continue with the next topic in the skin infections, that is the viral skin infections. Okay, so the first one is going to be the Molluscum contagiosum, yes, and followed by HPV, HSV and the varicella infection. So what is the full form of HPV? But you guys can see HPV is a human papilloma virus, and what is the HSV is the Herpes Simplex Virus. Okay, and HPV is usually we refer it as warts, which is going to be the next chapter, the next topic we will discuss. Okay, so warts is a very general term we use these days, right? Warts, but what is a proper medical term for it is 𝗲𝗵𝗵𝗺 vulgaris. Okay, so this is what we use, 𝗲𝗵𝗵𝗺 vulgaris. So what is it? Is usually a tumor, right? It's a benign tumor of the skin, okay, which is caused by a virus. Okay, as simple as that. Yes, but if you go ahead, let us just straight away come to the image we have here. Yes, so first of all, how would you describe this image? Yes, that is the first thing, right? How would you describe this image? As you can see, that the first thing I see, the borders are well defined. That much I can say. The borders are well defined, and in the next one, it is the growth is not flat. It's not flat. It is the growth is raised, quite raised in this case. Yes, so this was one of my patients. Yes, and as we discuss this topic, we will also see the treatments, how we took this out, and we also have the image, the follow-up images are also there lined up in the next page. Okay, so we come back to the initial topic we have here, right? So we are reading about warts, 𝗲𝗵𝗵𝗺 vulgaris, okay, and which is caused by HPV, human papilloma virus. Okay, so as we know that there are a lot of HPV virus, like there is 1, 6, 16, 18, and there are a lot, right? But the one which is most common, which causes a plantar infection, is the HPV-1. All right, this is one thing we have to remember. Clearly stated over here that the plantar warts which are there are being caused by HPV-1. Okay, and the next one, these are the anogenital warts. Yes, we usually read these in the OBGY, yes, and also in the PSM. In OBGY, why do we read? Because we have the whole treatment aspect is being discussed there. And why do we read in PSM is because of the vaccines, right? What vaccine we can give to prevent this is my question to you, but as we go ahead, we will discuss the whole thing as well. Okay, so HPV-1 plantar warts, HPV-6 and 11 anogenital warts. Okay, so this thing is clear right here. Okay, so the next thing we're going to discuss is the transmission. Yes, of how are these warts transmitted. So it's a very infamous thing, right? So skin to skin contact. Yeah, so that is why the HPV is a skin to skin direct contact. Yes, so that is the reason both of the partners should be treated, right? Because there are a very high chance of the reinfection. Okay, so the same thing we're going to do as we did in the first image, as we discussed, is we're going to describe the image. Okay, so first thing we see, this is a very well defined lesion. Okay, it is a dry, very well defined lesion, but you can see it is slightly elevated. Slight elevation is there. Okay, but the borders are well defined. This much we can say very clearly. Okay, yeah, this is the very clearly written here that well defined lesions, yes, consistent thickness, and it can be flat or raised. In the first case we saw here, yeah, we can see here the lesions is quite raised up. Okay, so we move on to the next thing, that is the clinical diagnosis. How are we going to do it, right? So thrombosed capillaries, we're going to find thrombosed capillaries. This is a very hot word. Yes, we will see, but how are we going to find it is when we take the scrapings of the skin, yes, of the debris, we will find thrombosed capillaries, which is being referred as seeds. Okay, this is not a very high yield thing from this topic. The high yielding thing is the vaccine, which HPV causes plantar, which HPV causes the anogenital warts, yes, and what is the specific treatment for it. Okay, let us discuss. Treatment for this patient is going to be salicylic acid, yes, first of all the patient is going to come to us, yes, so we will just treat them on a very, we will not do any surgical interventions, we will just try to subside it, yes. So one of it is the medical thing we can do, yes, we can apply some ointments, we can give them some systemic drugs, and the next thing we can do is we can give them some surgical options, yes, we will discuss them. We can provide them some salicylic acid, we can use liquid nitrogen, that is the cryotherapy, we can do it, yes. As we go further, there is an image for cryotherapy as well. Trichloroacetic acid, and the next one is the curettage and desiccation, yes, we can do it. This is simply, we can use an electrocautery and we can just take it out, yes, it's very simple procedure, yes. And we can also use the laser for treating these patients, yes. So what are the first line of treatment for the anogenital warts? Yes, the first thing we can do is when the patient comes to us, so these are the drugs which are applied by the patients, yes. So what we can do is these are the imiquimod, syncactins and podophyllotoxins. These are the three things we can use in the patients, but these are applied by the patients, yes. And what procedures we can do, we will discuss now, okay. What procedures we can do is we can have the carbon dioxide laser, yes, we can perform a laser, and we can just burn and just have a complete resection of the wart, okay. And we can also use trichloroacetic acid, and in the surgery we can have cryosurgery and electrocautery, we discussed earlier, yes. So one thing, what can we do to prevent it? Yeah, that is the next question, is what thing we can do to prevent it is, first of all, we can have some vaccines given to the patients, yes. So this is the question for the PSM, right? This is the PSM question, that what can we actually do to prevent it? We can give a vaccine. This is a Gardasil vaccine, Gardasil 9, which is a nonavalent vaccine, yes. So what all serological subtypes are there? 6, 11, 16, 18, 31, 33, 45, 52 and 58. This number seems to be very long, yes. So how I remembered, by 3 layers, right? First of all, this one it is very easy to remember, like 6, 11, 16, 18. Yes, we have this thing in the top of our head almost most of the time. The second one is 31, 33. The last one, this one is, I feel a bit confusing one, at least for me. How I remembered it was 4, 5, 5, 2, 5, 8. So 4, 5, 5, 2, 5, 8. Yes, so these were the last 3 serological subtypes of the nonavalent vaccine. Okay, so we can repeat it once again: 6, 11, 16, 18, 31, 33, 4, 5, 5, 2, 5, 8. Okay, that is it. And the higher ones which are there, 16 and 18, these are these ones are most, they cause cervical cancer. Okay, so this is the OBGY point here, yes, that it causes cervical cancer. Okay, this image, yes, which I am showing you, this image is a follow-up of the patient we discussed earlier. Yes, as you can see clearly that we have incised, so we did electrocautery in this patient, we did electrocautery, and we have completely incised, completely taken out the wart which was there, and this was done in complete one sitting. Yes, so first what we gave some anesthetic agent, yes, just over here we injected anesthetic agent, we used lignocaine, 3% lignocaine we used, and after that we completely excised it, we using an electrocautery. Okay, alright, so this is the fourth one that we are discussing, and as you can see on the screen, this is Molluscum contagiosum. So as we go ahead, we will see that why is it caused, what is the most common organism that spreads it, and what are the characteristic properties of this, and what words we can look up in the MCQ or anywhere while we are solving questions and stuff. Okay, so first of all, yes, so what is it caused by? Yes, so this is so obviously we are reading the viral topic, so it should be some virus, right? So it is caused by pox virus. Okay, so pox virus is the causative agent for this, for the Molluscum contagiosum. And what is the means of spread? is just by contact to contact. Yes, so we have a direct transmission occurring through this, and because of this feature, there is a very characteristic word known as auto-inoculation, which is seen in Molluscum contagiosum. So what does this mean is, we can, if this was the first lesion to appear in this patient, yes, so what's going to happen as and when this lesion ages, is going to infect the other one, and the other one, and the other one gets infected. So there is a series of chain reaction which happens. So at one spot we can see lesions of different sizes, because each of them are being self-inoculated by the older one. Okay, alright, so that is the most characteristic finding, is auto-inoculation. Okay, so we see this usually in children. So in pediatric patients we see Molluscum contagiosum. We can see this characteristic lesions. Yes, so first of all, how would we describe this? Yes, so based on our discussion on morphology, dermatology, yes, so you can try to describe the lesion, and based on the size, yes, that is one hint I like to give. So these are what? These are the characteristic finding is going to be, these are shiny papules. So we are using the word papules. So my question to you is, what is the size that the term papules can be used, right? So please do answer that. Shiny papules with central umbilication. Okay, and the answer to this question is, the size is almost, this is less than 1 centimeter. Okay, alright. So these are the characteristic findings of Molluscum contagiosum. Okay, and the location, where can we usually find in children's and adults? So in children's, basically we are going to find on the trunk, face. Yes, so as listed here, we can see on the face, back, chest, and the extremities. But in the adults, the presentation is actually very different. We will find it on the perineal areas. Perineal region, we will find the lesions of Molluscum contagiosum. So let us continue the discussion. Yes, so about the diagnosis. So the diagnosis of this is usually just by clinical findings. Yes, so we can see the lesions wherever they are, and we can diagnose it. This is a very good representation. This is a very good biopsy finding of the lesions, as you can see, and we can clearly elicit here that this region is been corresponding to this part. The depression we can see is of this. So we can clearly see why there is central umbilication, right? And let us talk about the treatment options we have. So usually this is a pretty self-limiting condition, yes, but the thing is that whenever this heals, there will be some sort of scarring left. So we can offer some cosmetic treatments. Yes, so first of all is the cryotherapy. We can just do a curettage, yes, and what we can also do is we can use the electrocautery, and we can just take out the lesions, and we can leave some margins around it so that it heals well, but there will be scarring, some sort of scarring will be there. Okay, and we can also use some topical agents, yes, canthedrin and trichloroacetic acid, which is a chemical peel, yes, which is chemical peel we use. And there's also a very famous chemical peel we use on the face usually, it is the glycolic acid we use on the face pretty oftenly in dermatology, right? So this is another image of the lesions of Molluscum contagiosum. As you can see, there is central umbilication here, and the thing we just discussed is the auto-inoculations. Okay, alright. So this is all about Molluscum contagiosum. Thank you so much.